Behind me you see one of two locations where we have established a program called Ribbons of Remembrance. The other location is outdoors at Lenoir Preserve in Yonkers, where we have a similar structure where individuals can remember those that they've lost, those that were important to them, by taking a purple ribbon, writing their names on it, and then tying it up in a place to be permanently there as a remembrance. And whether it's indoors because of this time of the year weather, or outdoors at the beautiful Lenoir Preserve where you overlook the Palisades and the Hudson River, you realize that there's a moment of contemplation to try to put into some context what the loss of life is and what the experience that we've gone through now 2 years is. We encourage you to visit here or visit Lenoir Preserve and make that statement yourself in the privacy of your own heart for the person that you're thinking of as you write their name on and as you put them there to be remembered. 2,687 residents of Westchester County have died. I always say, and every time I say this, they're not statistics. They're human beings. Like we are, they lived, they loved, they were loved, they had family members, they had co-workers, they had friends, they had people who they knew in all the years that they lived here in Westchester County. 2 years ago today, every one of those 2,687 people were as alive as you and I were to this day. And the tragedy of losing them is incalculable. And when somebody asks me at any point in time, what would you do to save any one of those lives, much less a large portion of those lives, you would naturally say anything. And the price for losing them is the price of constantly worrying about how we might spread our disease to someone else. I've heard it said that masks don't work. It seems to me that in a civil society we try not to sneeze in each other's faces or cough in each other's faces because we recognize that that is a direct conveyance of whatever germs we have, and in the day of COVID, how much more viral load do we give to some other person if we don't wear a mask to reduce it. If you think masks stop the disease from happening, then you set an impossible bar for the disease. But if you believe that masks reduce the likelihood of it by some percentage, depending on the circumstances, then you'd be correct. And the same is true for vaccinations. But when this pandemic began 2 years ago, we didn't really know what we were facing. There was a containment zone created by the state, by the governor of the state of that day, and we found that we had to test to find out who had COVID. And the testing was done by brave individuals from our public health department nurses. They were spotlighted on 60 Minutes, who went out in teams and slowly, in people's homes, one at a time, tested them for COVID. It's almost antiquated to think of that being the method of testing now. We most recently, at the holiday season, had long lines in front of every test center where people wanted to get home kits or be tested in place. How could we have ever processed all those tests when they had to originally go to a single laboratory in the national government? And then it was made more easy by having a single laboratory in each state to process all the cases. That's how this started. When we turned Glen Island over to the state of New York, Northwell Health, and they created a drive-through testing location, it was a miracle come to life, that we could now test people at some higher level of percentages and find out how many people had COVID. But we started out with hand washing, hand sanitizing, social distancing, and mask wearing. Those are the tools we had in the beginning. And we lost, of those 2,600, 2,700 people, we lost over 1,500 people before the first vaccine could be administered. Roughly halfway through this experience, vaccines came to market. Some people were concerned that they came to market too soon in their minds, and most of us, the vast majority of Westchester residents, greeted the presence of vaccinations as the potential most important thing that could have happened to save us in this. People drove to the other end of New York State or got on a plane and went to another state in order to get a vaccination sooner than they would have by waiting here because the lines and the appointments were 2 and 3 and 4 months in advance. With each of these things, each of us remember back. Just as I remember back the refrigerator truck, I remember the first time that we had the opening of Glen Island. I remember, too, when we had the vaccinations available, and we realized that we had to provide them in a more concrete way. And we took the county center, which is a home for basketball and other events, and turned it into a vaccination center where at its peak, we vaccinated 2,200 people a day, to the point where over 90% of Westchester residents received the first dose of vaccinations. A closely similar percentage got the second dose. We are now still, to this day still, trying to encourage those to get the third dose, AKA the booster shot. Although now it's not just a booster, a nice thing to do. It is part of a completed protocol to fight this. And we waited a long time, if you recall, when the vaccinations were only available to some people, people of advanced age, people of certain kinds of illnesses, were not available to everyone. And we went down the pole of age and ability and physical status before vaccinations were available. That's part of our memory bank. We had parts of our whole society shut down during this, closed all gyms, closed all types of public settings and activities. Some could be transmitted into virtual, some had to be eliminated. How many people did we lose that we couldn't say goodbye to? There could not be a wake, could not be a shiva, there could not be a service either in a house of worship or at a graveside. And we couldn't have that moment in a hospital where a wife could say goodbye to her husband of many years. She had to be sequestered from him in this last moment of death. She couldn't hold him or touch him to say goodbye. That's what this virus has done to us. And if I do get upset sometimes when I hear people try to argue with me over the death statistics, how do we know that all of these people died from COVID? I'm stunned, frankly. It's the loss of human life. Why would you argue over such things when you lose a human life? We have come a long way. We have seen the Delta variant, the Omicron variant, which I received the disease during the Omicron variant. And some of us have gotten through the experience without being infected. Some have been infected with mild symptoms or no symptoms at all. Some of us were at death's door. And by the grace of whoever we see God to be, we came back from death's door and rejoined us. And I have stories of friends who've told me, I was in the hospital, I didn't think I would make it, but they're still with us today. And that's the number that goes along with the 2,687 deaths. How many people might have died but didn't die because we all took a responsibility, whether it was to vaccinate, whether it was to test, whether it's to socially distance, to do those things that protected somebody else. And that person still is with us today. I had the opportunity to learn a little lesson about leadership. Many years ago, probably about 25, 30 years ago, I was in my corporate years and I was meeting a client. And I remember standing on the corner of 38th and Madison in Manhattan. And I was a little early for the luncheon appointment, so I was outside the restaurant. And I was standing there the day before cell phones, which I would have got on the cell phone like we all would have. And I was jingling the coins in my pocket, and I pulled out, and it turned out I had 36 cents of coins in my pocket. Most of us don't carry much change these days. You can check your own pockets to see. It was a quarter, a dime, and a penny. And I had the time to look and to think, and I saw on it the images of what are commonly believed to be our three greatest presidents: George Washington on the quarter, Abraham Lincoln on the penny, and Franklin Roosevelt on the dime. And I thought what I've learned with my undergraduate degree in history, what I knew about those three men. They are seen as the greatest presidents. They took us through the greatest crises in our country, the Revolutionary War and the starting of the country, the Civil War, and the Depression and World War II together. But I also thought about who was Washington before he became Washington? Who was Lincoln before he became Lincoln? And who was Roosevelt before he became FDR Roosevelt? And history will tell you that George Washington was considered the least intellectual of all the founding fathers. You had brilliant minds like John Adams and Thomas Jefferson, and General Washington was a planter who had experience in military affairs. And while he had universal respect, he was not in the middle of the greatest debates of the founding father era. Abraham Lincoln was considered a backwoods lawyer from the wilderness of rural Illinois, who couldn't possibly have the sophistication to take on a responsibility like this. And Franklin Roosevelt was running because his name was the same as a great president a few decades before him. And he was seen, frankly, as a dilettante. And those who knew him knew that he was paralyzed and would never walk again. How could he lead a country that was paralyzed by the Depression? What we learned in the ultimate story of Washington, Lincoln, and Roosevelt is that people can rise to the moment. People have talents that we may not be able to see from the outside looking in. And I would argue the story of the Revolution, the story of the Civil War, the story of the Depression and the Civil War, of the World War II, was not just written by great individuals. It was written by a society that understood the moment and rose to that moment of sacrifice, that whether wartime or peacetime sacrifice, those generations before us saw the difficulties of the moment and rose to that occasion. Every farmer, every small shopkeeper in the revolutionary days, every person alive in the North and the South during the Civil War, and average everyday people through the Depression, people like my mother and father, and perhaps yours if you're of a certain age. And what we've learned through COVID is that it isn't the leadership of a great leader. It is the willingness of all of us to understand the moment that we're in and to make sacrifices. If getting a shot in your arm, if putting a mask on your face is the sacrifice of your personal freedom, it's a sacrifice you make to not add to that list of those who died. It's your statement that somebody who may not be as healthy as you might be subject to this disease, and you want to protect them. That is the sacrifice that we have been going through, and we will continue to go through, and perhaps at some level have to always go through. Medical science will tell us that. This has been a lesson for me, and I'm sure it's been a lesson for you. Our religious leaders help connect these things to eternal truths. In my faith tradition as a Christian, I remember the scripture that says, if you have faith the size of a mustard seed, you would tell that tree, be uprooted, and move it into the ocean. These moments have been moments to test our faith, and our faith in an Almighty, and our faith in democracy. Whether or not we, as free citizens, on our own, without the dictates of one single ruler, do we have inside of us the discipline, the perseverance, the stamina day after day after day to work through what this pandemic gave us? That question is not fully answered yet because we don't know what's ahead. As I mentioned a few minutes ago, after 2 years, we were not done with the Revolutionary War, nor the Civil War, nor the Depression, nor World War II. It took us longer, a longer period of time of sacrifice. And there may be more sacrifice yet ahead. We hope that a year from today, this number doesn't move at all in terms of fatalities, and if it does, it moves to the least amount possible. We hope that we can return to normal. We can reopen our parks and have our festivals, enjoy our summer concerts, be with our children, be with our aged parents, be with the people that we love. No government wants to interact with that. No government wants to shut down the economy of a country, the economy of a city. No government wants to do that. Those who argue that argument are arguing for other reasons. They're not looking at the reality of it. We have been through a test, and the testing isn't over yet. But in ourselves, each of us, we know what we've had to endure. Damia Harris Madden has spoken about what she's had to endure in terms of pain and suffering. Each of us know. And we have to find that resolve. Right now on the other side of the globe, there are citizens who are surrounded by a hostile group of people who are prepared to annihilate them. What sacrifice may they make in the next week, 10 days, compared to the sacrifice that we're being asked to make by showing a certain amount of discipline and perseverance and stamina in staying together? For my personal feelings, I want to thank all of you, all of those who work for the government, Westchester County, and the administration and the executive branch. All of those who've added their professional skills, Dr. Amler, the people in the health department, the people in the public safety department, and the correctional department, all of whom rose to the occasion. I want to thank the men and the women of our clergy for giving us emotional support when we desperately needed it. I want to thank all of you, whether your talent is in poetry or music or any of the other performing arts, for giving us that strength that you give us when we need it most. We are not through this yet. Hopefully we are substantially through it.